This gorgeous woman here is a few minutes out. What we did for Carla is I did a little filler in the inner brow, an area that just makes no sense. But you can see how young this brow is. I even didn't do anything under her eyes because we've been doing this. I rebalanced her nose because there was a lot of bony show. And once that bony show is improved, the nose looks better. I was telling her that a lot of my facelifts I do a rhinoplasty on. But look how pretty that nose tip is. I don't take any credit for that. That's all God. But you see how great she looks. The other thing we did today, we've done some temple fills, but what we really did today was pretty unique. We did a hairline fill, and that's made a very nice difference for her. Did a little downturn. She was bothered by the fact that the earlobes were starting to have this slit-like appearance and the fact that it was losing some of the fullness, and so we did a little bit of treatment around the earlobes, and you can see how beautiful that is. You're happy, right?
Oh, I love it. I'm excited.
That's great. This is just a few minutes out. We also did Botox, so a little bit swelling up around the eyes. Tell the audience here a little bit about your experience with me compared to what you had in the past.
Several years back, I had another physician that is actually a dermatologist, and he inserted Sculptra, and for 2 weeks I couldn't go anywhere. People in church were moving away from me. It looked so terrible. I was so badly bruised. So I'm just so excited with Dr. Lamb that I can have this done and turn around and go back to work within 30 minutes.
And you like the design?
Oh, I love it. Not only are your procedure, I didn't have to ice anything down. With other physicians, I've had to have ice treatments. I didn't have to ice anything down. I don't have any soreness, no bruising.
How was the pain level with my treatments compared to what you...
I didn't feel anything.
A lot easier than elsewhere, right?
Oh, yes. I felt nothing.
Using the cannulas make a big difference. And this is really, just to summarize, injecting in very unconventional areas to make a transforming result in Carla's face, which is, again, how many people inject inner brows? Almost no one. How many people inject behind the hairline? Almost no one. How many people inject to balance the nose bridge? It's a little small right now. It looks a little bit wide, but it won't be when it settles down. But just covering that bone. You know, this, in earlobes, yes, people do that. And downturns, yes. The early pre-jowl, yes. Canine, yes. So those are some classic zones. But I think what was fun today is doing a lot of unconventional areas that are just transformative. And I think part of the reason we've done this is that Carla's has had a lot of beautiful work done already, and so today it was just about touch-up. She's a big gala coming up in a few days, and so just wanted to make her look super sexy for that. And I think she's a beautiful lady. And you know, when I have a beautiful lady, when I do the work, it's like having, I always say, you know, Giorgio Armani has a 4'5", 180-pound person. It's not going to come out as beautiful. And she's really a model for my work. She's a beautiful lady, has a little bit early aging, and takes care of her body, takes care of her fitness. It makes my work look great. So I look like a stud here just doing this because she really has beautiful facial features and just did little treatments here to do a beautiful outcome.
Okay, one more thing.
Oh, yeah, please.
On my drive over, I had my rearview mirror down, and I was looking in the mirror thinking, okay, what do I want Dr. Lamb to do?
Yeah.
And what is so awesome is when I can come in here, and in 30 minutes later, without any pain, it's done. And not only that, you're an incredible artist. And it just is so comforting to know that when I leave, that I'm going to look so much better than 30 minutes before I arrived.
Cool. Thank you, Carla.
Thank you.